Welcome back to Podocyte Talk. In today's episode, we're diving into recent advances in nephrology, with 3 studies examining promising treatments for rare and challenging kidney conditions. We'll cover a study on Iptacopan's effects in C3 glomerulopathy, C3G, a trial on Ravulizumab for managing IgA nephropathy, and an investigation into the kidney outcomes of SGLT2 inhibitors in diabetic kidney disease following AKI. Let's look at what these findings could mean for patient care. Iptacopan in patients with C3 glomerulopathy. This study examined Iptacopan, an oral complement inhibitor targeting factor B, which is essential in the alternative complement pathway. C3G is a rare, progressive kidney disease often leading to kidney failure, with high recurrence in transplant patients. This Phase 2 extension study included 26 adults with C3G, split into 2 groups. Cohort A with native kidney C3G and Cohort B with recurrent C3G following kidney transplantation. Patients received open-label Iptacopan for 12 months. In Cohort A, Iptacopan led to a 57% reduction in the 24-hour urine protein-creatinine ratio, UPCR, and improved kidney function, with an average eGFR increase of 6.83 milliliters per min and 1.73 meter-twetter. Additionally, serum C3 levels rose significantly, reflecting reduced disease activity. Cohort B had stable urinary protein excretion, and eGFR values remained close to baseline, though serum C3 values nearly doubled, suggesting a positive response to Iptacopan. Both cohorts showed reduced C3 deposits on kidney biopsies, indicating the potential of Iptacopan to modulate C3G. These findings support Iptacopan's potential to stabilize kidney function and reduce proteinuria in C3G, highlighting the need for further studies on long-term treatment. With Iptacopan's encouraging results for C3G, let's shift our focus to another study exploring Ravulizumab in IgA nephropathy. Ravulizumab in IgA nephropathy. Ravulizumab, a complement C5 inhibitor, was evaluated in patients with IgA nephropathy, where the complement system plays a key role in disease progression. This Phase 2 trial involved adults with proteinuria 1 GARD and stable renin-angiotensin blockade, randomized in a 2:1 ratio to receive Ravulizumab intravenously every 8 weeks or a placebo for 26 weeks, followed by open-label Ravulizumab for all patients until week 50. The primary outcome focused on proteinuria reduction at week 26, with secondary outcomes examining eGFR changes in proteinuria at week 50. At 26 weeks, Ravulizumab showed a 41.9% reduction in proteinuria compared to 16.8% with placebo. By week 50, the Ravulizumab group had a -44.8% change in proteinuria, and patients who crossed from placebo to Ravulizumab reached a -45.1% reduction. While changes in eGFR were modest, with a slight stabilization for Ravulizumab compared to a decline in the placebo group, the treatment was well tolerated, showing an adverse event profile similar to placebo. Ravulizumab demonstrated a meaningful reduction in proteinuria and trends toward eGFR stabilization, providing support for further investigation. A Phase 3 trial is already underway to validate these findings. With the findings on Ravulizumab, let's move to our final study, which explores the role of SGLT2 inhibitors in veterans with diabetic kidney disease following AKI. Kidney outcomes with SGLT2 inhibitors after AKI in veterans with diabetic kidney disease. This retrospective study examined the effect of SGLT2 inhibitors on kidney outcomes in veterans with type 2 diabetes and diabetic kidney disease who had experienced acute kidney injury, AKI. The study population included over 10,000 veterans, of whom 2,794 were prescribed an SGLT2 inhibitor after an AKI hospitalization. The study looked at 2 main outcomes: CKD progression and recurrent hospitalization with AKI. Results showed that SGLT2 inhibitor use was associated with a 28% lower risk of CKD progression and a 25% reduction in recurrent AKI risk compared to those not on SGLT2 inhibitors. These findings suggest that SGLT2 inhibitors may provide protective benefits in diabetic kidney disease even after AKI, and support their use for better long-term kidney outcomes. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment. Check the description for links to the studies discussed in this episode, and stay tuned for more insights into kidney disease research and clinical innovations. Tune in now to stay informed.